This next person, what do you think of all of that? Dr. Todd Ellerin, Director of Infectious Diseases at South Shore Health. Doctor, we really do always appreciate your insight. And when you heard what Ed just said, and hopefully you just heard it, what's your first reaction to that?
Well, I mean, first of all, I agree that it's good news that we haven't seen new cases so far from that large pool party, but it's still early. I think we still have to give it another week or two before we can be more convinced that we won't see new cases. Remember, there is that lag between when you're infected and when you start to see hospitalizations.
Yeah, but this is coming up on the second weekend, so a lot of time is getting in there. We are continuing to see a downward trend in all of the key indicators that state officials are tracking, in particular new and positive cases, hospitalizations. Can you give us the picture? What does COVID-19 look like right now here in the Commonwealth through your eyes?
This is really good news, Ed. I mean, we are seeing a significant decrease in new cases. The percentage of positive patients is about 6.5%. That's down from about 20% at our peak. The number of new hospitalizations way down, and deaths are down by more than 90%. So we're doing really well.
Those are numbers that are going in the right direction for sure. We've talked about this before, the cases and the deaths tied to long-term care facilities. Those numbers were up substantially. Now some are preparing to allow visitors to go into those places again, distancing, other restrictions. So in your opinion, what precautions do families need to take, and how critical are they given that vulnerable population, because it's different?
Right, Maria, we've talked about this before, right? This is our most vulnerable population. This is an example where I think smart testing is really important. So I would urge anyone who's going to visit, who's going to get right in there into the rooms of their loved ones, try to get tested to make sure you're negative before you go in. And of course, the PPE, making sure you're masked, and whatever the PPE that these facilities are recommending, we have to abide by that. And physical distancing, I think, is important. And I want to say that's really hard, because the elderly have taken, it's a real emotional toll that we haven't been able to hug them.
You want to just reach out and hug. Let's talk about hydroxychloroquine. Medical analysis has gone this way on it. The Lancet is now retracting a study that concludes that the drug was dangerous for COVID-19 patients. At the same time, the WHO is resuming a halted trial involving the drug. Can you sort through this for us? What about hydroxychloroquine?
So remember, this was a very large observational study, 96,000 patients, about 15,000 patients on hydroxychloroquine and possibly azithromycin. So what they found was there was a significant increased risk of death in those that were on hydroxychloroquine and azithromycin compared to people who are not. But what experts were saying is, we don't necessarily trust this data. These seem like really big numbers. We don't necessarily think hydroxychloroquine works well, but that remains to be seen. So what actually happened is 3 of the authors have retracted the data, have retracted their study because of problems with data integrity. So they couldn't confirm the data that came out of that. So now what's happening is we have randomized controlled trials that are still ongoing. So we still don't know whether hydroxychloroquine with or without azithromycin is effective, not effective, or harmful.
Doc, thank you so much. It's great to see you.
Thank you, Doctor. Be well, as we always say.